Fred, we've talked before about how your posture is influencing your neck pain and your back pain. If you really want to feel better, let's go back to what we talked about the other day in clinic. In my clinic day, I see a lot of complaints revolving around lower back pain, trapezius pain, and rhomboid pain that I think are in large part due to how we sit and work if we happen to spend a lot of time at the desk or on the couch. So general principles that I've mentioned before and we'll keep coming back to are, can we keep our ears over shoulders over our hips? And if we happen to be working at a desk, the other thing that helps keep our shoulders and back, upper back pain-free are making sure that we don't overextend at the arm and shoulder. So a lot of the time we'll have our keyboard far away from us where our shoulders are elevated, protracted and forward, and we're internally rotated, and we have a little bit of a hunch here. And if you can notice that my ears are not over my shoulders, which are not over my hips, and I've got a lot of slouch in my lower back, or we end up slouched back with a lot of lumbar curve, and our spine isn't stacked on top of itself. Whereas, if we can keep ears over shoulders over hips, and have our elbows more or less resting at our sides with our shoulders in retraction and depression, and with our arms a little bit in external rather than internal rotation, then we don't put a lot of stress on the trapezius or the rhomboids. One of my favorite exercises to strengthen up our upper back and shoulders to compensate for the slouching and hunching we do while sitting is what I call wall goalposts. So with our back nice and flat up against the wall, we're not arching and letting our lower back come off the wall. We're really trying to keep it pressed against the wall as well. Our shoulders are pinched together behind our back. We push our elbows into the wall and then rotate our wrists up as much as possible, trying to get them to the wall. If we can't, that's fine. Just keep them engaged as much as possible, trying to pull them into the wall. And then we're just going to gently slide our elbows up the wall as much as possible, keeping our forearms vertical and bringing our elbows high as possible. Slowly slide back down till we're back at 90-90. Slowly slide back up. We're going to feel a nice burn in the back of our shoulders, and that's normal and expected. Try to do it to the intensity that doesn't make you grimace. If we can go for 5 or 10 nice slow reps, this will be a good distance towards correcting that shoulder pain from sitting. We can do our wall goalposts either sitting on the floor or sitting on the chair. Once again, shoulders pinched behind my back. I'm not letting my lower back arch off of the chair. I'm keeping it pressed back against the chair. Elbows glued and wrists pulled as much as your body allows towards the wall. Slowly slide up, slowly slide down. Other exercises that we can do to strengthen up our upper back and rhomboids to make sure that our posture can remain in good position throughout the day are doing some rows with an exercise rubber band. You might even be able to use an old bike tire if you have one available. Now, Fred, we've talked about how you need to maintain a more active core and be a little less passive with these exercises. Do you mind if I show the audience? So we can do this with one hand or two hand. I usually attach my bike tire or rubber band to a door handle or pole or something like that. And so as we stand here, it's easy to let the shoulders get pulled forward. So before I do anything, I'm going to pull my shoulders back. I might even thinking about trying to point my sternum in the direction that the rubber band is anchored on. I'm going to externally rotate so that my thumbs are up and not in. And then I'm going to put a little bit of pressure in my belly, like trying to pull my rib cage into my hips. And then I'm going to pull my elbows down to my side and try to pull my hands into my rib cage right at around the nipple level. And notice that my shoulders are down and my shoulders are back and my chest is forward, but I'm also not arched at the back either. It's also useful sometimes to practice one-armed pulls. And so if we've got our opposite leg from the hand that's grabbing the rubber band forward, the rubber band is pulling me almost off balance, but I'm standing with good posture. My ears are over shoulders over my hips. I'm going to pull my shoulder back and rotate my thumb to the outside. And I'm going to reach with my other hand towards the end of the rubber band while I'm pulling the rubber band elbow into my hip. And my shoulder, once again, is down and back, and my thumb is externally rotated. Nice and controlled repetitions. See if we can get... Fred has mentioned several times that it feels like as he stands up, he's getting stuck, and it takes a minute to get all the way upright after sitting for a long time. Part of the reason for that is, oh, thanks, Fred, is the psoas muscle, which attaches from the top of the leg through our hips, and not shown here, but it does attach to our lower back. And so our hip flexor muscle, the muscle that brings our knee up to our chest, if we sit for a long time, you can imagine that it just gets a little bit short. So things that we can do to help with that are some split squats or lunges. Once we stand up from the chair, we can immediately turn around and place one foot on the chair, and making sure that my feet are parallel. I don't want my back foot to turn out too much like so. So staying strong on the balls of my feet, I'm going to push off this back foot and drive forward, letting my knee come forward, keeping a strong posture, and I could feel a good stretch here. And then I'm going to use this stretch to pull me back upright. Sometimes we might need a little bit of extra help and need some balance, so using a broom or counter or other sort of rail. Strong back foot, trying to keep this leg straight as possible. I'm going to drive forward with this knee, keeping my chest upright, lowering down, trying to get my hamstrings to touch my calves. And once I feel I'm at my end range of motion, where I might compromise my balance or I wouldn't be strong enough to get back up, I'm going to use this stretch in the front of my back hip to pull me back up to upright. See if we can get 10 to 15 repetitions in this exercise.